Well, it's possible COVID-19 could be the leading cause of death in Indiana this year. According to the most recent data available from the Centers for Disease Control, deaths from COVID-19 trail only cancer and heart disease as the leading killer of Hoosiers. The number of confirmed deaths from COVID is approaching 6,500. Now, in an open letter this week, healthcare workers pleaded with Hoosiers to help them fight the virus by wearing masks, social distancing, and getting the vaccine when it's available. Meanwhile, the state is ordering hospitals to postpone or reschedule non-emergency surgeries for the next few weeks.
The decision to postpone non-emergent hospital procedures reflects the fact that our hospital systems are stretched to the limit.
A new executive order from the governor also bars local health departments from waiving social gathering limits imposed by the state. So, for an instance, in counties experiencing the worst COVID spread, it's 25 people or less. In the second to worst category, orange, on the state's color-coded map, it's 50. The new restrictions come as Indiana's number of COVID-19 deaths and hospitalizations have spiked far past the state's peaks during the initial surge of the cases during the spring. Indiana officials say the state expects to get about 55,000 doses of a COVID-19 vaccine next week, with further amounts still unknown. Drug maker Pfizer expects to have its vaccine approved in the coming days. Healthcare workers and nursing home residents get top of the priority list, but the very first doses aren't enough to cover that entire population.
Because it is a smaller amount, that very first week, the invitation to get registered and get the vaccine is going directly to the hospitals across the state, and then we'll go to our long-term care staff.
Because initial supply is limited, Indiana was required to choose just 5 hospitals statewide that will get the dose first. Those are in Jeffersonville, Evansville, Indianapolis, Munster, and Fort Wayne. IU Health South Central Region Chief Medical Officer Dr. Daniel Handel joins us to talk about how the IU Health system is dealing with the pandemic. Doctor, thank you very much for being with us. Let's start with hospital capacities related to COVID-19. We've heard the Bloomington Hospital moving beds in conference rooms. What's the situation like there?
So actually, historically, Bloomington Hospital has actually had a higher number of licensed beds than we currently use. What we focus on now is actually the staffed beds, and we are actually turning some of the rooms that historically have been hospital rooms back into hospital rooms from being used as offices. So it is still within our licensed capacity for beds that we have at Bloomington Hospital, but given this most recent surge in COVID cases, we want to make sure that we're ready for every possible scenario.
How is the hospital staff coping with the increase in cases? You know, Indiana, number 2 in the country. This was per capita new cases.
Right. They're tired. I mean, I think, we've been dealing with this since March, and the current spike we're going through is much worse than what we saw in the spring. So we're doing everything we can to support them. We're trying to bring in additional resources in terms of personnel to help backfill them and support them. And it's the quicker we can get through this, the better, because they're really stepping up to the plate, and I'm extremely proud of them. But it's been a long haul.
So Bloomington was not one of the first 5 hospitals to receive the first batch of vaccines. When do you expect Bloomington to get the vaccine, and then what's that plan going to be for distribution?
So we are hopeful that after the first wave that IU Health Bloomington Hospital will be the next group, which is looking approximately the week of December 31st that everything goes according to plan, but we're waiting for official approval from the state.
And if you had one, we just have a couple seconds, if you had one thing to tell people to help out right now, what would that be?
The vaccine can't come quick enough. We need people to continue to wear their masks, to stay at home and socially distance until we can get enough people vaccinated. Just because the vaccine is going to be available soon, it's not soon enough for people to let down their guards.
Okay, thank you very much, Doctor. Appreciate it.
My pleasure. Take care.